At this time of adversity, millions of people face life or death decisions while seeking a better future. Behind the statistics and the politics are the profound stories of those who are migrating. They're people like you and me, crossing borders in search of opportunity, even survival. In the past year, tens of thousands unexpectedly landed here in New York City, a new frontier in this global crisis. And when they did, Aid for Life and Aid for AIDS knew exactly how to help. With offices across Latin America, our sister organizations have a deep understanding of those who are migrating. Their journey is dangerous and full of hardship. They travel through jungles and across deserts, endure extreme weather, and face physical abuse and sexual violence. Migrants and refugees are a key population in the fight against HIV. They are exposed to abuse, and many are at risk of turning to sex work to survive while they are unable to work legally. Our work began in the 1990s when we found ways to send life-saving HIV medicine to Latin Americans who could not access treatment. We called it Aid for AIDS. In 2018, we began delivering infant formula to thousands of Venezuelan babies to protect them from contracting HIV while breastfeeding, so they did not have to choose between sickness and nourishment. Aid for Life was born. We have adapted quickly to respond to the global migration crisis. Millions of people are migrating due to a mix of political, economic, environmental, and violence-related reasons. Worldwide, over 7.7 million Venezuelan migrants and refugees are looking for a better life, and they are not alone. Migration impacts Ecuadorians, Colombians, and other nationalities coming from within Latin America and other continents. The estimates are that 1 billion people will be on the move by 2050. Peru is home to the second largest number of Venezuelans, upwards of 1.5 million people. Aid for AIDS Peru offers services for the prevention of sexually transmitted infections, access to treatment for HIV and syphilis, and legal support for migration status. Since 2021, we have served close to 6,000 migrants and refugees in Peru. Colombia has received the most Venezuelan migrants and refugees, close to 3 million people. Since 2018, Aid for AIDS Colombia has delivered HIV prevention services to 60,000 migrants and refugees. Through the Access to Treatment program, we've also ensured HIV treatment continuity for 3,500 migrants and initiated a PrEP program that provides HIV prevention medicine to 250 migrants that lack access to public health. In Cúcuta, across from the Simón Bolívar Bridge, where migrants cross the border from Venezuela, we've provided 30,000 hot meals since January and continue serving close to 1,000 meals a week. In the first 9 months of 2023, close to 400,000 people crossed the Darien Gap that separates Panama and Colombia, almost double the number from the previous year. That number includes 40,000 children. This year, Aid for AIDS Panama began providing services there, offering HIV prevention and treatment, distributing condoms, clothing, footwear, and infant formula. On October 1st, we opened our 4th office in Panama, this time in the Darien Gap, to continue serving those making this dangerous crossing. Matamoros, Mexico is known for violent drug cartels and is also where a large share of the migrant population is concentrated. People travel thousands of miles only to become the target of human rights abuses. Every day, thousands of people try to get an appointment through CBP One, the U.S. government's app that migrants must access to gain entry, but only few succeed. CBP One offers 1,450 appointments per day. On one day alone, over 60,000 people can vie for the available spots. We work closely with the government in Nuevo León to provide HIV prevention services to this vulnerable population and nutritional supplements to children. In New York, over 120,000 asylum seekers have arrived since last year, when the first groups were sent on buses by the governors of southern states. An estimated 64,000 people are currently being housed in 210 emergency shelters and 17 humanitarian response centers, all funded by the City of New York. We began responding to the migration crisis in New York City in July of 2022 and have provided over 20,000 asylum seekers with humanitarian relief, integrating new neighbors into the fabric of the city by providing clothing, shoes, infant strollers, culturally appropriate hot meals, haircuts, and connections to health and legal services. In partnership with a paralegal firm that is culturally connected to Latin America, we've supported over 1,500 people, offering free legal support for asylum applications, work permits, and temporary protective status, essential steps that lead to self-sufficiency. Continuing our work fighting HIV, we have also reached 3,000 Spanish speakers with HIV prevention education and outreach, and done hundreds of HIV tests. In 2023, our HIV medicine redistribution program hit a milestone, surpassing 20,000 people kept on HIV treatment in 75 countries, worth over $200 million. We are committed to the belief that every individual deserves to live with dignity. Our work, centered on integration, has the power to profoundly transform lives. Your involvement is the key to transforming many more. Together, we can make a difference.